For the first time I can remember, we're having a healthcare recession. In order to deal with the pandemic, hospitals suspended all sorts of non-emergency procedures. That's a problem if you need knee replacement, and it's potentially an existential problem for the hospitals because these surgeries are how they really make their money. Hospitals have been working overtime to beat this virus, and the process, well, they're losing fortunes when they're doing it. But now that it's looking for, like our healthcare system won't be overwhelmed, what do they need to do to bring back these procedures? What's the safe way for hospitals to go back to something closer to normal? I want to hear from an expert, which is why I'm thrilled to have Scott Sperling. He's the co-president of Thoms H Lee Partners, and more key to us today in this crisis, the chairman of Massachusetts General Brigham, which happens to own one of the most important hospitals in the country. Mr. Sperling, welcome back to Mad Money.
Thank you, Jim.
All right, so Scott, fill me in. We bent the curve so we wouldn't be overwhelmed. It looks like that's been accomplished. We have a huge number of empty, I guess, ICUs all over the country. At the same time, the hospitals are bleeding from the eyeballs for cash. What are we supposed to do?
You're exactly right. So let me give you a couple of small data points. At the peak, we had built capacity. We had more than doubled our ICU capacity to handle COVID-19 patients that needed high acuity care. Every one of them had ventilators, so we had almost 900 such ICU beds. We utilized at the very peak about 70 to 75%. We never got close to 100%. So we had the capacity to handle what was the largest surge that we had imagined. We are currently only utilizing about 33% of that peak capacity. So we've been able to take some things down. But to your point, the net result of the success that we've had addressing the truly great need of COVID-19 patients has been that we have lots and lots of other patients who have had delayed procedures that we may call elective, but to them it creates significant pain and potentially very expensive and longer-lasting complications. So I will give you, some sense of that. We have seen a 30% reduction in cancer diagnoses. It's not because there's less cancer. It's because people aren't coming in with the symptoms.
Amazing.
We haven't had that. We have not been able to do the surgeries on things such as significant orthopedic procedures or even brain surgeries that often can be delayed but do cause significant pain and suffering for patients. The result is not only the economic crisis for the healthcare system that you mentioned, but it is a truly worrisome national healthcare crisis for so many patients of so many different age categories. We've done a remarkable job, and when I say we, it's not me, but it's our caregivers. It's the individuals who are running our system. It's the Ann Kolbanskis, who's the CEO of Mass General Brigham, and the Peter Slavins, the president of Mass General, and Betsy Nabel, the president of the Brigham, and Ron Walls, and so many other people, Greg Myers of the world, the Tim Ferrisses. These are people in our system who have done a remarkable job at trying to make sure that we can improve the outcomes for the COVID patients. And that's something that we've done quite well.
Well, but Scott, why don't you talk about that for a second? Because I think that your outcomes, it varies so much from state to state. Other states, people listening to you will know that you guys figured out a lot of stuff that they should figure out.
So, for the most vulnerable group, over age 80, in March, half of those people were not able to survive. Today, 75% of them are able to survive based on what we know to do with these patients. We know much better when to use respirators, how to use them. We know how to treat the kidney disease that has come around with this. Things like remdesivir, which the early indications are very strong. We've seen all of that. We do know that given the nature of how it works, which is to stop replication of the virus, the earlier you use it, the more powerful the impact could potentially be, and so we're going to see that. We've taken the med-surg patients who have COVID-19 down from 6 days of staying in the hospital to 4. We've taken the ICU patients from 14 days to 10, and again, we're seeing much better outcomes.
What do you think
we're much better prepared to deal with whatever comes next, whether it's another surge or more likely a chronic level of patients at a much lower level, but that will last until we have a vaccine.
Well, that's what I want to ask you about, because you see, I see all these pictures this weekend about the bars with big lines and the packed beaches. I mean, to me, look, you're chairman of a great hospital system. Is that a nightmare waiting to happen, or are we just in the Northeast just too cloistered?
Look, you've seen wide variation. So, for example, New York had over 1,400 deaths per million, right, and Florida had 82.
Whoa.
I know people were critical of Governor DeSantis in Florida, but one of the things that he did that was so smart that I think, he may have done better than, for example, New York, is he targeted a population where you can isolate and protect them. So much more aggressive at making sure nursing homes, no visitors, everybody gets tested who's a caregiver. So we really need to learn lessons from this, that we can look at the most vulnerable populations where the death rates are dramatically higher and deal with those. In the middle, we should use common sense.
Right.
It's low cost to wear a mask. It's low cost to keep 6 to 7 feet away from somebody else. You can go to an outdoor stadium and hopefully not be too close to people. Probably not crowd back into an indoor venue
right,
at any point in the near future. So there's a number of things that we can do that are common sense, that are low cost, that will help us as we manage through this. And again, keep in mind that, as you know, flattening the curve is about spreading this out. It's not about
right,
eliminating the
right,
eventual number. It's about spreading it out so the healthcare system can deal with it. But as I mentioned, the thing that people have to understand is the healthcare system has so much more capacity and capability to deal with this. Now what we have to make sure is the healthcare system itself doesn't die. And to
right,
your point, if you look at the financial situation, community hospitals all through Massachusetts are on the verge of not being able to make payroll. Our own system is losing billions of dollars. So, we need to make sure that we have the ability to take care of the people who need our help and who depend upon us. So there's a financial element. But as I said before, right, more importantly to our people, it's taking care of the 30-year-old who doesn't have COVID-19, but who has a serious ailment,
right,
who has a serious neurological issue, who has diabetes. We have a huge spike in the number of amputations. And the reason for that is people with diabetic infections of some sort are not coming into the system. Those are not things that we've been able to deal with. And we need to get back to dealing with that. And it's so important that we recognize we have the capabilities. It's time for us to get back to helping all of the people of this country.
All right, Scott, it's always great to have you. You have more insight than anyone else we have on this situation. Scott Sperling is the chairman of Mass Gen Brigham. And boy, I'll tell you, he really understands what the hell's going on. Also, of course, co-president of Thoms H Lee Partners. Stick with Cramer.
Don't miss a second of Mad Money. Follow @Jim Cramer on Twitter. Have a question? Tweet Cramer. #MadTweets. Send Jim an email to madmoney@cnbc.com or give us a call at 1-800-743-CNBC. Miss something? Head to madmoney.cnbc.com.